Yeah, so here we go. So metabolism is a really important aspect of pharmacokinetics, which involves a lot of long answer type questions, and a lot of MCQs are also focused on this particular concept, the concept of metabolism. So I would like to ask my viewers, I would like to ask my subscribers, that what is the purpose of metabolism? Why do we require metabolism of a drug in our body? So there are two main reasons. Number one is to expel the drug from the body by converting it into much simpler forms. Means converting to forms which are much more easier to excrete. And second one being, metabolism is required for detoxification. You know, this is a very beautiful mechanism of our body, the mechanism of metabolism. Whenever we, let's say we give a drug A and we came to develop a toxicity of it, a toxicity of A develops, so our body, basically liver, which is much more involved in metabolism, it will metabolize the drug into inactive form if it is possible, and let our body get detoxified. So detoxification is also a very important purpose of metabolism. Another significant purpose, another very important purpose is to convert a non-polar drug to polar drug. You must understand this, that many of the drugs pass out in urine. Urine being polar, must ensure, the body must ensure that the drug gets converted into a polar form so that it can easily pass out through urine. For disintegration or removal, we definitely need a hydrophilic form of a drug so that it can easily pass out in urine. Drugs that are hydrophilic, these excrete out with very minimal metabolism, and it's easy for our body to get rid of them. There's also a very prominent clinical example here which must be remembered, the example of aminoglycosides. These are antimicrobials, antibiotics, which would be dealt in the chapter of antimicrobials. So aminoglycosides, these are given through IV route. They are given via intravenous route and they are injectable. So obviously injectable drugs, as we talked about, these are polar and ionic. So they are already polar. They would require very less amount of metabolism to enter into urine. They are most of the time excreted unchanged since they are already polar. Now see, our body has various sites. There are various sites for metabolism, but the most prominent of them being liver. So therefore we need to ensure when we are giving certain drugs which are toxic, that liver is in the perfect condition for it to metabolize the drug and convert into non-toxic forms. Other important sites include lung. For general anesthesia, lung is the site of metabolism as it has the enzyme esterase, which is responsible. You'll get to know about the composition of general anesthesia, and then you will definitely get to know what is the role of esterase when we will discuss the chapter of general anesthesia. Now see, we must remember that drug can either be given in an inactivated form or it can directly be given in an activated form. So there are only two aspects here, inactivated or activated. So see, three things can happen, three kind of metabolism can happen in our body if we are giving either an inactive or an active drug. The inactive drug can get converted into an active drug. An active drug can get converted into another active form of the drug, or an active drug can be converted into an inactivated form. So see, the first one, inactive to active, the example includes levodopa or L-dopa, which gets converted into dopamine once it crosses the blood-brain barrier. Active to active, now see, this metabolism might be toxic or non-toxic. So the activated form which is converted into another activated form, the another activated form can either be toxic or it can be non-toxic. Both chances are there. Now this inactive drug which gets converted into active, it is also known as prodrug. And in active to inactive, example includes paracetamol, and it is the most common form of metabolism. Most of the drugs metabolize in this particular manner. Now see, we must understand this, that somehow if we induce the metabolism, somehow if we accelerate these three things, what is the possibility? Let's say we are giving a drug, it is in an inactive form, and we kind of induce the metabolism so that it gets converted into activated form. What would happen? I want to give yourself a thinking about this. Just give it a try. Now see, if some drug is getting converted from inactivated to active form, surely there would be an increase in therapeutic effect. There will definitely be an increase in therapeutic effect, but at the very same time there are chances that toxicity will also increase. Okay, let's take another example. Let's say an active drug is getting converted into another form of the active drug, and we are inducing the metabolism of it. Now what would happen? There are both chances. Either the toxicity can increase or the toxicity can decrease depending upon the toxicity of the converted active form. There is also another case, active to inactive. Now in this particular case, therapeutic effect will definitely decrease. So we must know what is the interaction between the two drugs. For example, let us take a classical example, a clinical example of oral contraceptive pills. Okay, when we are giving oral contraceptive pills to a particular patient, we must be aware of what all drugs can induce its metabolism. Cause if we give another drug which kind of induces its metabolism, its contraceptive failure can occur. So don't give any inducer with OCP, otherwise contraceptive failure is definitely going to occur, which would be a really big mistake by a clinician. Now let us say somehow we inhibit the three kinds of metabolisms. Okay, let us take an example of inactive to active. Now what would happen if I decrease the metabolism here, if I inhibit the metabolism? In inactive to active, the therapeutic effect will decrease, whereas from active to active, both things can happen, either toxicity or it can become non-toxic. Active to inactive, definitely the therapeutic effect will increase, because the active form will be living for a longer life, for a longer time in the plasma. Hope this concept becomes clear, because this is the gist of the concept of metabolism. It will help you understand metabolism to its depth. Now see, metabolism can occur in two kinds of phases. Either there can be phase 1 or there can be phase 2. Phase 1 and phase 2. We are not going into depth. You'll just understand this superficially. You have the standard books with you. You can get to have a reference of it. Phase 1. Now see, phase 1 is non-synthetic and phase 2 is synthetic. With the name, it's justifiable that phase 1 won't be producing any new stuff, whereas in phase 2 a new stuff would be formed. Okay, so in phase 1, that is non-synthetic, the examples include oxidation, reduction, there can be cyclization in which addition of a benzene ring occurs. Then there is decyclization in which removal of the benzene ring occurs. Then there is hydrolysis. In phase 2, all reactions that are done by transferase enzyme and there is addition of a group, all are synthetic or phase 2 reactions. This must be kept in mind. Now let us discuss briefly about first pass metabolism. I'll help you with a flow chart that will clear out all your concepts about first pass metabolism, which is a very important topic in pharmacology.